Hello, everyone. My name is Alondra Ruiz Miranda, and for my case study, I decided to talk about the treatment room. The reason I decided to do the treatment room is because it fits perfectly with my career in becoming an RN, so I decided to talk about PTSD, which is post traumatic stress disorder. I feel like many of us may know someone or of someone who may be affected by this disorder and would be more than glad to help if possible. What is PTSD? Many times we feel like we know what it is, or we assume that it can happen to a person who is in war or who has been there, but that's not the case for everyone. According to the American Psychiatric Association, it is a disorder that can occur in people who have experienced or witnessed a traumatic event such as a natural disaster, a serious accident, a terrorist act, war or combat, rape, or other violent personal assault. So it's not just any person who has been in war. For my two theories, I decided to talk about dual representation theory. In this theory, there are two different memory representations for the individual. These are assumed to be the sensation near representation and the more verbally oriented C-reps. Flashbacks can cause harm to the individual as he or she remembers what occurred and they feel like it is reoccurring again. Everything feels present and not in the past. For my other theory, I will be talking about the cognitive theory, where expectancies and individuals' amount of control over the situation, where stress will lead the individual to have emotional, behavioral, and biological effects. The feeling of the past reoccurring again is always there. The individual will feel frustrated at many times with no positive things to come its way. For my situation, I decided, of course, to talk about PTSD, where a rise of cases of PTSD in a community seemed to be rising and nothing was being done for them. So the family members became curious as to how they could help them. So a few psychologists were hired to interrogate the ones with PTSD. It was shocking how the government was not pushing for more studies to be done since many of the affected were individuals who had served for the country. So you would think that the government would want the individuals to have a normal life like they had prior to serving the country. The psychologists were involved in a few ways. They had therapy sessions both in group and one-on-one with the individuals. There were 30 individuals who were broken into 6 groups of 5 for their therapies. So then 10 of them were placed with only medicine, another 10 with only therapy, and the other 10 with both medicine and therapy. The medicine that was used was FAAH inhibitors. This was done for about 10 days, and they were there for about a month. The reports then stated that with medicine, the individual felt sad and could easily remember their past. The ones that had therapy were not sad because they were with others, but they still had moments of flashbacks, so they felt like they needed an extra push. And the patients that had both of them, medicine and therapy, reported to feel great, and they looked great according to the psychologist. So it is easy to say that patients that are given therapy and medicine will live more of a normal life like we live than those who have PTSD. The input from the psychologist, they recommended for the patients to have therapy sessions and medicine. It was greatly received by patient and family members, where they saw light after a long time of being told that nothing could be done for them. Once again, the reason that I chose this is because I want every person to live the life that we deserve, to be happy. Many times I feel like we only see the physical wounds of a person and we don't pay attention to the wounds that are inside of a person, and most times the inside wounds are the ones that mostly affect a person than the physical ones. As for me, I have been inspired for my future to have myself and future coworkers always work towards a solution for every patient that will come across us. I feel like we should never give up when a patient is struggling. We should always be there for them and expect for a solution to come. Many things are possible as long as we work as a team and strive for better things. So as long as we're doing that, we can come up with a solution. Thank you.